Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle Live in studio. It's a little bit of a kind of a cloudy, damp, Washington fall day. But nevertheless, sun shines here in the studio. We're here for you. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, you've come up with the same thing, something that doesn't work. Well, how would you like to fix it without drugs or without surgery? This is your opportunity right here, right now, today. I do have a topic for you, one that is fascinating, one that unfortunately is affecting way too many people, more people than should be on a natural cycle of life. And what are we talking about? We're talking about your hormones, not just lady hormones and women hormones, but men hormones and guy hormones. I mean, you got to look at it because we all have hormones. We all have testosterone and estrogen, progesterone, and other hormones such as, well, how about insulin? How about neurochemical hormones? How about all those things that make you feel good or make you feel awful? But we're going to talk about the subject of hormone transition, andropause, which is not you ladies. This is the guys we're talking about, the guys that are having tremendous amount of problems. And ladies, obviously you going through menopause or any of the perimenopause, the pre-transitional states, or from young to old, acne that has to do with hormonal imbalance. There's a lot of different pieces of this puzzle. So we're talking about the Zen of hormones. And who better to talk about the Zen of Hormones? Somebody that we, love and appreciate very dearly in our practice, Dr. Stephanie Pina.
Good morning.
Hey, Doc.
I thought we were saying we're keeping this non-sexist.
Yeah,
we're going to include everything.
We did. I just did. I said guys and women and boys and children and everybody else, right?
Okay.
I mean, you briefed me on the way up.
Thyroid doesn't care if you're a man or a female.
It doesn't.
It's in there too. It
is. Thyroid's a problem, and so we're going to try to, put a different light on the subject and one to understand really what happens. You know what kills me? And I'm going to be sexist just for a second, but on a male sense. I'm going to go against the guys. Think about this for a minute. All the advertising that's out there today for the different erectile dysfunction drugs, from Viagra to Cialis, and the list really goes on. And then in the natural world, I mean, we can talk about deer antler velvet. We can talk about all kinds of things, and we can spend the whole subject just doing that. But that's not what we're talking about. We're not talking about putting a fix in things. We're trying to get why these things are happening and what you can do about it. I know this Wednesday, Dr. Pina is going to be your presenter, your host at the Roselle Center for Healing, and she's going to be talking about the Zen of Hormones. So it's open to everybody. It's, not just women, but guys as well. So if you're having problems and, you don't know which way to turn, and you're afraid of the drugs because they have significant side effects, including cancer, this is an opportunity for you to really learn what this matrix is all about. And as always, these are our courtesy. This is a freebie to all of you. All you need to do is call 703-698-7117 to register. Tell my staff you'd like to be there. But having said that, Dr. Stephanie, let's get into this a little bit. And I want to ask you a basic question. This is not just an uncommon situation, but it's way too frequent relative to hormonal disturbance and balance. Why?
Well, I think what's interesting is we're so used to when something goes wrong with us or we start feeling symptoms, we look for that one source. If I fix that one thing, everything's going to go away. If I've been diagnosed with hyperthyroid or hyperthyroid, it must just be the thyroid. If I have a lot of fatigue, we talk a lot about adrenals, it must just be the adrenals. So if I fix that one thing, it's all going to go away. Well, the problem is the endocrine system is a great way of interconnecting the whole system. One signal from one thing, one gland to another gland actually affects so much more in the body. So it's real easy to go, okay, I'm going to take an herb or change my diet or do stress reduction. But when you look at it, you've got to treat the whole body the way we always go back to treat the whole thing. It's not just one particular place. And I think we're so set on this idea that one cure is going to take care of everything.
Here, take this pill and call me in the morning.
Exactly.
Yeah, and that's not what it's all about. You know, I've used the statement, and it's really very true, that men today in their early 30s have the sperm count of guys who were in their 60s in the 1950s. That's not okay. You know, that's what we talked about. As a matter of fact, I mentioned over the last couple of weeks, it's called the vanishing male. Guys are losing their capacity to be male, to be fertile, to be productive, to build muscle mass, to have energy, to have capacity. And, you know, the thing is, women need testosterone too. And it's that depletion of that drug, and it's the hormones that are not balanced properly within the system that's giving us all these troubles. We have foods today that aren't worth eating. And we have foods that are laden with all kinds of exogenous hormones.
Yeah, and absolutely. And there needs to be a balance of what's internal and external, but unfortunately the stuff we're getting from the outside isn't exactly the same force kind of stuff that we're taking on the inside. So our body doesn't know what to do, one, with this new chemical that is coming through the foods and stuff, and it then kind of tries to make it into a regular hormone, but it ends up triggering our own receptors, and then we get dominance in certain hormones, like estrogen dominance. We get deficiencies in other hormones, whether it's testosterone deficiency or adrenal gland insufficiency. There's so many things going on, so it's a real balance within itself, and that's why you have to address every single part of that piece of the puzzle.
You know, women are basically put into a position in the spotlight today that they're told that their bodies are less than optimal. And what I'm saying about that is simply this. You know, and you just touched on it, is that the estrogen levels are way too high. And so you're going to get cancer, or you're going to get other debilitating situations, or you're going to lose your bone mass, and it goes on, right? So the body wasn't designed to do that. The body was designed to stay in balance, that estrogen, progesterone levels are in an equilibrium, that there are transitionary phases that we go through, where we go through adolescent stage into where a woman begins to menstruate. We go through into a stage where women begin to stop ovulating, and then we go into transition stage into older life. None of those are meant to be problematic. They're supposed to be smooth transitions. And guys, we're going to touch upon you in a second, but that's not the case, is it?
No, it's what it tends to be is, you know, a female will tend to start, if they've got any kind of hormonal imbalances and it's, say, throwing off their cycle, you know, well before, you know, they're in their prime. Basically what's going to happen is they're going to be put on birth control pills, which is there to supposedly regulate their cycle. And there's going to be this transition, and then as soon as that ends, or there's pregnancy, that there's another hormonal transition. So there's all these transitions that are natural, but we're giving the body stuff that makes it unnatural. And then all of a sudden, instead of having a nice slow balance between both progesterone and estrogen, which estrogen tends to get most of the glory,
and the blame.
Basically what tends to happen is that you don't have that nice balance. You have both of those hormones going down kind of about the same pace over time. But also our endogenous ways of producing estrogen, like in fat cells, which may be increased due to stress, they're sitting there going, well, we'll still produce it too. So you have this unequal balance of things going on, and our triggers in our bodies aren't quite capable of always catching up with that.
Well, we know people in this society are way too heavy, and we're going to use the term way too fat. And the problem with fat, as you just said, it will produce hormones. It produces the estrogenic effect in the system. So you have a society, United States of America, where people are way outside the normal scales, or where they should be. Body fat content is what I'm talking about. And that doesn't mean you're heavy. That means you're skinny. You can be a skinny fat person. And that means that your fat ratios are not what they're supposed to be. So you're producing all these excessive hormones, and now you got a problem because there's no buffering in the system.
Absolutely.
You know, in the second half of the program, I want to talk a little bit about Eastern medicine and how they look at it. That's why we're calling the Zen of Hormones.
It's all about balance, yin and yang, you know.
It is.
Estrogen, progesterone, testosterone.
Yeah, and everything. But even guys, I mean, we're seeing men which is unheard of, come up with breast cancers today. I mean, that didn't happen before. And now up to, some authors say 3%, some say about 2% of all breast cancers are male. That's not okay. The prostate and breast tissue are genetically the same. So, but now because of the preponderance of estrogens, the bad estrogens that are floating around, these systems are breaking down. We don't have anything to buffer it because we're constantly being bombarded. So let's take us through kind of a scenario. And this is men and women. Okay, people are born, and in a good world, and unless something goes wrong, injury, stress, biochemicals, stuff that they shouldn't be putting in their body, they should live well and long and prosper. Star Wars or Star Trek. Anyway, never mind. So here I go again. Here's the situation. We don't. Take us through the scenario. We talked a little bit about the foods and the environment and so forth, but it's a slow cascade. And ultimately, we find ourselves in a real crisis, which we are today, across the board in this country.
Well, I mean, we're, as at the very beginning, even in development, I mean, we're born with the ability, like with women, they're going to born with many more eggs than they're ever going to need. So we know that we have the innate ability. We look like little babies when we come out, so our hormones aren't as active as they are, say, when we get through puberty, whereas the next first time where we see a lot of changes with those hormones. And that's why sometimes that time's not such a great time for people to go through. But as you start to mature and develop, those hormones start to balance out to a certain way unless they start getting stresses and triggers. Now, some of those can be completely natural, like a woman going through pregnancy. Her hormones have to change in order to allow a baby to develop. A male has to change in order to keep up their sexual vigor and basically help to procreate. So when those start to change and that time for reproduction, his styles start to decrease, it should be gradual, like we said. But what ends up happening is now we have different stressors and triggers that, years ago, or even, way back when we were first, becoming humans, we didn't see. We weren't always running from the tigers. We were able to sleep on time. We were able to get the rest that we needed. We worked with the seasons. And essentially now we're go, go, go all the time. So that's putting more of a stress on there. So the hormones are trying to keep up with us one way or the other. So it's kind of saying, you know what, if you want more cortisol to keep doing this, I'm going to have to shut down the reproductive tract. And that's where you're starting to see difficult transitions through menopause, andropause, and then going forward from there.
Can't have it all. It's got to be in balance. You touched upon the subject, and I want to get into it a little bit more. And you said yin and yang. And basically what we're going to talk about is excesses and deficiencies within the body. Yang problems, excesses, if you will, or lack of excesses. Mm-hmm. Okay, so you can have either way. Or yin, which we have to have. We have to have balance, to pull things down. Subtleties within the system and deficiency that or excessive patterns that overwhelm the other piece. And it's kind of a confusing subject, but they're really simple when you start thinking about it. And when you have those situations, you have guys will have loss of libido. They'll have loss of muscle mass if they're young deficient, and that's so they're decrease. They have a decrease in something that they should have plenty of. And women, the same thing. You have the same lack of drive, lack of purpose, the fatigue patterns and so forth when that testosterone level begins to go down. And forget about libido; it's gone. It's doesn't even exist for you at that point. So they have to be markedly in sync, if you will. This Wednesday evening, your host, our guest today in studio, Dr. Stephanie Pina, will be presenting an interesting topic called the Zen of Hormones. October the 20th, this coming Wednesday evening, 7:30 p.m. at the Roselle Center for Healing. Join us if you have any problems, no matter what your age, and you know that your doctor said, well, it's a hormonal thing. You have bad menstrual periods, guys, that you've lost your drive. You don't have the energy. You don't have the want to anymore. Ladies, it's kind of, what do you expect for your age type of thing. These things aren't necessary. It doesn't have to be. It doesn't have to happen that way. So what we're going to do is show you how to fix this, and there's nobody better to get that done than Dr. Pina. The Zen of Hormones this Wednesday, October the 20th. We're coming up to a break, and when we come back afterwards, we're going to talk about this balance mechanism. We're going to talk about some of the things you're exposed to that are causing these problems, and we have some calls we're going to get to, but we're here at 888-630-9625. Love to talk to you on any subject. We'll be right back. This is Dr. Tom Roselle.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio today. 888-630-9625. That's 888-630-9625. Love to hear from you. Let's talk about what you want to talk about. We're talking about hormones, both affecting ladies and gentlemen, children and men and older people. You know, it's all over the place. It doesn't have to be that way. In studio today with me, Dr. Stephanie Pina will be your host, your presenter this Wednesday evening, October the 20th at the Roselle Center for Healing. All you need to do is give us a call, 703-698-7117. Tell my staff that you'd like to be there. We require a reservation, but it doesn't cost you anything. So take advantage of these classes. We're doing them for your educational purposes. That's why we've been doing them for all the years we've been doing them. And we see a lot of you on a regular basis, but we'd like to see some new faces, people that want to learn and want to challenge. And, you know, if there's any docs out there that disagree with us, this is the lady that will give you the skinny on it. Dr. Pina is our fertility expert in our practice as well. And she, because of her approach in traditional Chinese medicine, she has allowed for many happy families and babies that have shown up. It's amazing to me.
Oh, yes. We have a couple 20-week pregnancies right now. They're back to back, so they're in a race. Now they want to see who can finish with a healthy baby first.
And these are people that couldn't get pregnant before they came in.
Yeah, absolutely. Things like low sperm count that was unknown, different types of unknown infertility, basically. And what's interesting is when we have people that want to do and use holistic medicine, there does become a time when you kind of have to look at the markers and see what's going on, but there's ways of kind of addressing, like I said, the whole body. And it helps out with the reproductive tract when they don't have any answers in conventional medicine.
You know, when you see a patient, and I examine every one of my patients, I look at their mouth and I look at their tongue and I see what's going on internally. And if you have a patient that has mold and fungus and it shows up as a white coat near the intestinal identifiers in the tongue, you know that they're going to really have a hard time if it's a young man getting anybody pregnant. It's just not going to happen. Having said that, Eric, thank you for holding and hanging on there for so long. How can we help you, sir?
Hi, I'm 23 years old, and I've been experiencing some erectile dysfunction for the past few months. It started late July. I had masturbated, and kind of since then things haven't really been the same. My erections are about like 50, 60% of what they used to be. And
okay, let me ask you some quick questions, okay? Here's the deal. You're a young guy, and you shouldn't be having those kind of problems. So there is a why is that behind that. Generally, if you had a trauma, if you had an injury to your low back, there's been any kind of blows, or you have any back pain that's been chronic, the S1 nerve root, this is the nerve that comes off the fifth disc space of your low back, goes directly to the scrotal area in the man. And if that nerve is pinched, you're going to have problems with it. If you've been exposed to any chemistry, if you have a tendency to drink water out of plastics, or if you're drinking sodas, or if you eat meat that is not free range, all of those things have high levels of estrogenic effects, and they're going to dampen your capacity and your ability to have an erection, to have any kind of libido response. So subsequently, you got to have to look at that. That's a balance issue. So neurologically, you have to look at that first. The sound and tone of your voice is a low depleted type of voice, and subsequently that tells me that your yang, your kidney energy inside your body is not where it should be. All of those things can be handled, Eric, and it's just a matter of finding out what they look like, what the balance of hormones are, what your energetics are really about, and any kind of history that took place after that. Even dental work that you may have had, where there may have been fillings that were put in, or you're exposed to any kind of anesthetics of any sort, can cause that system not to work properly. Again, doable. You just have to look at the entire thing. Let me ask you a question. Have you ever had mumps?
No.
Okay. Have you ever had any inoculations, vaccines, because of chickenpox or anything of that nature?
No.
Okay. So that's a good thing, because otherwise you would have the onslaught of different chemistries and heavy metals and so forth. Eric, what I would suggest that you do is Wednesday evening, come on in. We can talk to you much more in depth. But at your age, given the fact that it was working properly beforehand, shouldn't be an issue today, except there has to be a reason. There is a why is that in your particular case.
And also we want to look at what was else going on around that time, because there might have been a specific incident, but essentially what might have been happening is, even something basic like an aspirin or something like that to treat like that low back pain that Dr. Roselle was talking about, or other medications that, and a lot of antidepressants will decrease libido function, and also just, blood flow to the testes and to the penis as well. So
yeah, the reason that I asked him about mumps was simply because of the relationship between the parotid gland, where you get the mumps when you're a kid underneath your jaw area, and the testicles. When a man gets mumps when he's older, doesn't get it in the glands of his neck, he gets it in the testicles, and he ends up with, unfortunately, elephantiasis at some point. I mean, really big scrotal area, and it's painful and it's awful, but that mechanism also can be very subtle and very subdued, and it can come around as a low energetic piece. So you have to check that. In acupuncture, we were talking about there are channels that serve that as well.
Yeah, we have the kidney channel. We talked about the kidney yang, but essentially that becomes our basis for reproduction, and is almost like our adrenal glands as well, too, as far as producing more testosterone, producing other things. So what tends to happen is, we have to balance everything back.
Got to take a break. We're coming up for the news and some very important information. Don't go away. There's many more of you online. We will get to you. Our number here is 888-630-9625. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Indeed, we are here in studio, 888-630-9625. Love to talk to you. This Wednesday evening, Dr. Stephanie Pina, one of the better and the best that could actually handle the topic we're talking about today, the Zen of Hormones. She has an insight and intuitiveness when it comes to this. Why? Because she practices naturopathic medicine and also traditional Chinese medicine and will give you really what happens in the body. So if you'd like to attend this program, October the 20th, this Wednesday evening, 7:30 p.m. at the Roselle Center for Healing, call 703-698-7117. Dr. Stephanie, there's things that we should stay away from and make a difference, and we're going to talk a little bit about those, and I know you'll get into them a little bit on Wednesday evening. My mantra: sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. When it comes to hormones, there's one that I didn't include, two that I didn't include, that one of them, most women will hate me forever, saying that if you want your hormones back, you really can't overindulge, and that's chocolate. And we'll talk about why in a minute. Before we get to that, let's go back to the phones. Joseph, thank you for calling. How can I help you, sir?
Yes, hi, Doc. A question. I know you're not high on X-rays, but how about ultrasounds? The reason I ask is because that from time to time it sends this big van around to like Kmart parking lot in Annandale, where you can for a discounted rate on getting a series of ultrasounds. I'm reading from the literature now. Echocardiogram. Ultrasound, stroke carotid artery ultrasound, and an abdominal aortic aneurysm ultrasound. And I'm wondering, are those what it's discounted?
Joe's, I'll save it all for you. I don't have a problem with those at all. Ultrasound is not destructive in an adult in the cavity, the major cavity of the body, the heart, the neck, which they're going to do. They're going to do your carotids, they're going to do the aorta, and so forth. So not an issue. Go do it. I've done it. And but here's where ultrasound's a problem when it comes to developing tissue. When you have a child, baby, that is an embryo, that becomes a fetus, that is growing in the mother's womb, an ultrasound is very dangerous in my opinion. Why? If you watch an ultrasound application with a fetus, the child will move as far away and as abruptly as it can away from that ultrasound head. It's very much likened to a child being put next to a railroad track, maybe about 3 feet away, and a high-powered train going by as fast as it can. That vibrational effect is similar to that. And it will cause tissue damage, in my opinion, and a lot of kids that we're seeing with learning problems and so forth are a result of these multiple ultrasounds that are really not necessary unless a woman is going to choose to abort or choose to have some other procedure done. If you're going to carry a child through, other than one ultrasound perhaps at about the 5th month to 6th month where they can go in and do an in utero procedure, that beginning stage is ridiculous and does more damage than good. But in your particular situation, to answer your question directly, are ultrasounds safe for an adult to have a carotid ultrasound and an abdominal ultrasound done for a screening type of test? No problem. Go do it.
Oh, excellent. Okay, that's all I needed to know.
You're welcome. Thanks for calling.
Thank you.
Appreciate it. 888-630-9625, 888-630-9625. Love to talk to you. This Wednesday evening, Dr. Stephanie Pina will present the Zen of Hormones. Join us. I think you're going to have some fun doing that. We have a couple more callers. We will get to that. But, Dr. Pina, I want to talk a little bit about the process of how all this stuff really, really comes about. We've got women who now are experiencing way more breast cancers and ovarian cancers than ever before. We have guys that are struggling with impotency and prostate cancer. We have other hormone imbalances, like so much insulin resistance people are becoming diabetic, or they're a brittle diabetic, or they're in the pre-diabetic stage, or we have thyroid problems where, more and more where we have Hashimoto's thyroiditis, which is really the end product of all these other things we're talking about as well, which is an inflammatory pathway problem. How come? Why say you that?
Well, you can go back to just understanding the basic way that the endocrine system begins, and that's what's putting out our hormones. Is really a hormone is a response to something. It's supposed to create a change in the body, and it's based off of a stressor. So we get a response, we put out the hormone, it's supposed to balance out what we need to do, and then it's binding to those receptor sites, and each one of those hormones have a special receptor site where that cell pays attention to it. When that response happens, then we get a feedback loop back up to the brain or to the main organs, and then basically we can shut that hormone off. But the problem is now, whether it's stress or improper eating or lack of exercise, if we get too many triggers, our receptors on those cells stop paying attention to that hormone that's being released. So we don't get that feedback loop. So the body says, well, let's just put out more. Let's just put out more. So it's a catch-22 because your body's putting out more to a signal that it has nothing related to its normal pathways. So if there's increase of cortisol in the body, basically that's going to stop binding thyroid hormone. It's going to stop letting the testes and the ovaries start producing estrogen. And you may get fluctuations of those hormones, and all of a sudden the body thinks, oh, this must be, an adrenal issue. So you start working on different glands, but you're feeling it in different areas. So the receptor sites become important because other hormones can mimic the hormone that it's really supposed to pick up, and that's where there's a problem.
888-630-9625. Give us a call. Love to talk to you on any subject that you have in mind. This Wednesday evening, Zen of Hormones. How you register for that class is 703-698-7117. Let's go to the phones for a second, then I'm going to ask you another question. Diana, Chevy Chase, you have a question on Prevagen.
Yes, I hear it advertised every week on the radio, and I was just wondering what your thoughts are about that. And I have been taking DHA, and what do you think about that as well?
Well, any of the omega-3s, and as you go down through any of the EPAs or the EFAs are going to be very important for memory patterns, particularly as we age, because of the high levels of inflammatory problems that we end up with because of lifestyle. That's really what it's all about, in the lack of causing our brain to work the way it was meant to be. That means stressing it, learning new things, doing things, putting ourselves under stress patterns, and obviously giving ourselves some relaxation modes as well. But as you know, the Prevagen is from a jellyfish. And, there's a lot of guys out there beating the drum saying that this thing is the greatest thing since, whatever. But what happens is that as we get older, the neural synapses don't fire the way they're supposed to because of depletions and exposures. If we don't stress the brain, the brain will shrink. And, the whole thing with Prevagen is that it's supposed to protect the binding sites, the calcium binding sites in the brain, and by doing that and break down the proteins, the amino acids that will cause the brain to deteriorate. They're saying that they're getting results. Hasn't been around long enough to have a lot of studies. There's other things that I think that are much better. Just a simple cup of organic green tea. If you have a cup or two a day, and I mean organic green tea, and you don't have to do it decaffeinated, is extremely tissue protective and neural protective. It's one of the best things also for cancers, and prostate cancers and breast cancers. It has a tremendous effect on the system. But, to say that it's, Prevagen is the end all and be all. It was, it was first studied overseas and then brought back into this country. But the bottom line is it supposedly keeps cells alive longer by protecting the body from the calcium binding proteins that cause cell death. Now, whether that works or not, I think there's other things that you would use first, and relative to dietary changes, increasing your essential fatty acids up to, we start at 3,000 to 4,000 units of EFAs with our patients that need them, and it's based on testing. So, I wouldn't go off and think that it's all of that.
Right.
I hope I didn't confuse you.
No. I was just hesitant about all, they advertise every week the same thing for 1 hour.
Yeah, marketing is great. It's fantastic.
Yes.
And you can sell anything. But just remember, here's what I tell patients when they ask me about things. They say, well, they said there's a study on this, a study on this other thing, and based on the study it works to do this. Well, here's the deal. They don't tell you how many people were in the study. There may be 5 people. And these people may have come from a very depleted environment. And anything that you give them that has some nutritive sustenance is going to make a difference in their life.
Yes.
Okay? So you have to look at how the study was conducted, how big the study was, how long the study was, and then there's clinical anecdotal representations. Example, coconut oil is known to have a tremendous effect on dementia, Alzheimer's, and so forth, and a lot of neurogenic processes within the body. We use it in our office. We use it with our patients who are suffering neurological deterioration, and we unfortunately see way too much of it. Now, is it researched and the end product is absolutely factually sustained? No. Is there research going on that says anecdotally this has some important application? Yes. In our clinical experience, have we seen its application work with many patients? Yes. Across the board? No. So you have to look at it based on what's real and what isn't, and is it worth trying? Is it not worth trying? Does it have any side effects? You go to natural substances first across the board before anything else.
Yes.
What
type of tea were you referring to?
Green tea. Just green tea.
Green tea.
Yeah, organic green tea. And there's many different kinds out there, and brew it for about 10 minutes so it's nice and strong. And then sip on it, and you can have 2-3 cups a day, unless you know you're allergic to it, and then obviously don't. But otherwise, it's good stuff.
All right.
Diana, thank you for calling. I appreciate your phone call.
Thank you.
888-630-9625. Dr. Pina, let's talk a little bit about that yin and yang, that deficiency, and too much of a good thing is probably too much of anything.
It's all about moderation, right? You got to balance it.
It is.
Well, I think when you're thinking about the hormones itself, like I said, there's usually the body will actually create hormones that balance each other out. I mean, when you're talking about, we're always going back to estrogen and testosterone, but even estrogen and progesterone, they're there to balance each other out. They're there to keep each other in check. So when one tends to increase, the other one is going to have an effect one way or the other. So an estrogen dominance, when you have high estrogen, may actually start to look like it's a lower progesterone. Or if you have too low progesterone, you may still subclinically look fine as far as hormone testing, but it might be kind of creeping up as well too, so you're experiencing the symptoms of it as well. So things aren't always as clear as a lab value and as clear as symptoms, but the body's built to kind of try to balance itself out. It wants to do it. So we have to quit giving the outside sources, the bad foods, the lack of exercise, the increased stressors that are essentially going to throw us off to begin with.
Join us this Wednesday evening, 7:30 p.m. at the Roselle Center for Healing in Fairfax. We're just off the National Capital Beltway in the Red Cross building on Route 50, Arlington Boulevard. Easy to get to. It's real quick. No matter where you are around the area, it'll only take you a little bit of timing to make sure you're there. And this presentation will give you an insight, things that you can do to help yourself make a huge difference. And believe it or not, it takes a commitment on your part to change almost anything, but the body is extraordinarily forgiving. If you're willing to step up, if you're willing to do some of the things that you need to do, change some old habits, your body was made to live long and maintain itself without all these ebbs and flows and wax and wanes that we go through. We do most of that to ourselves. This is not something that, happens to us because it was meant to happen to us. The contrary is absolutely true. We're coming up to a break, and then when we come back, we have a couple more calls we're going to get to. If you want to reach us offline, off the air, you go to rosellecare.com. That's ROSELLECARE.com, and we will respond to you. It may take a little bit of time, but I promise you we'll get back. Don't go away. This is Dr. Tom Roselle.
WMAL-FM Woodbridge, Washington. WMAL Washington. WRQX HD2, Washington.
Welcome back. This is Dr. Tom Roselle. You listen to Dr. Tom Roselle live. We're always here at 12 noon, Sundays, 888-630-9625. That's how you find us in studio. How you find us outside the studio is go to rosellecare.com. That's ROSELLECARE.com. and check us out. See what we're all about. I think you'll enjoy the website. There's a couple of them attached to each other. There's another one called drtomroselle.com, and that's an interactive learning system. However, we're going to have a great Wednesday presentation for you. Dr. Stephanie Pina will be your host, and she'll be talking about the Zen of Hormones, what we've been talking about for the last hour, but in detail, in specifics for all of you, men and women. Remember, guys, many of you are going through andropause, which is the same thing as menopause, except for it's guys, and you're suffering with all kinds of problematic situations, which are avoidable. No confidence, depression, irritability, impotency, can't sleep, low energy levels, loss of any kind of motivation whatsoever. Not a good thing. George, thank you for holding. Appreciate it. How can I help you, sir?
Always good to listen to you, Dr. Roselle. My question today, I'm an older guy, over 55. Actually, I'm 60. Terrific shape. I have a friend that's taken testosterone supplements, and I've had my testosterone tested before, and they're within the normal range. And I told my doctor, basically, there's nothing normal about me. I'm not the normal build. I'm not the normal anything for 60. His answer was, well, that's just something that you have to accept. Now, my friend's taking these once a week, and man, this guy's got more energy and everything else I've ever seen him have. Is that a viable alternative for an older guy?
Most testosterone is bioidentical, but most physicians give too much of it. And subsequently, the side effects of that is not something that you want to get into, at least from my book. I'm a little older than you are, and I can still do the things that I want to do. But there's reasons that testosterone comes down. And it's not just due to the aging process that allow it to drop completely. If you have adequate amounts of testosterone in your body and it's not working for you, it's because of that inflammatory barrier that we were talking about. It can't get in, can't use it to the receptor sites. So there's things that you want to look at, like magnesium, like fatty acids, things of that nature that are causing it. If the body's in too much pain, the inflammatory levels stay way too high. If you have exposures to other than organic foods, because of all the byproducts they put in, you're going to increase that resistance, but you're also going to blunt your testosterone pathways. So there's no quick broad brush on this. You'd have to look at what your conversion levels from cholesterol to cortisol, DHEA, how they convert into your androgens, what the balance of the androgens are, and then see if your estrogen levels are too high compared to your testosterone. So it's not just about that one hormone. Will adding testosterone level to your body help? Yes, if you have the receptor sites available. Should you do it? Not without answering all those other questions. So
well, let me ask you this: can that be tested via blood test through somebody like yourself, which you're describing there?
Blood tests will give you the total amount in the blood, but it doesn't give you what's available going into the system. So we do two things: we do blood work, and then we do saliva. Saliva is what actually will transport. But then a complete examination, neurologically, energetically, and so forth, putting those pieces together, then you can really figure the pattern out. Give us a call. I'd love to talk to you. I've got to cut it short, George, but you can get a hold of me offline or at the Roselle Center for Healing. Dr. Pina, you got about 35 seconds less.
We're going to talk about the Zen of Hormones on Wednesday, and we're going to talk about how it all connects together. Think about things, how one hormone can affect the next one, how you can do things naturally, like using diet, herbs, and supplement and exercise to pull it together too, and how it all creates Zen in your body.
Love to see you this Wednesday evening. Give us a call at 703-698-7117 and register. See you then. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Health.